Hello, and welcome back to A Better World. This is your host, Mitchell J. Rabin, and we're very glad you're joining us again today. Today we are on location near Montreal, and we are here to speak with and learn about Dr. Claude Sabbah. Dr. Sabbah has been a pioneer in the field of medicine, in a sense, a new and very scientific approach to mind-body medicine. He has come to understand, after decades of research and experimentation, the relationship between psychological and emotional issues to the physical body, essentially, that is, to physical illness. And through his work, there are countless number of people around the world who are being healed of what have been considered intractable diseases. This is very much a first in the history of medicine that I know of. While many of the ideas that Dr. Sabbah has put forward and is basing his work on, which is the work of a German physician named Dr. Hammer, and you could say the entire array of psychosomatic medical literature that has been with us since virtually time immemorial, going back to traditional medicines, going to the Greeks, going to the psychoanalysts in the 20s and 30s, based on the work of Franz Alexander et al. He has amassed this information and gone further in a very scientific way, a very meaningful way, through which he has been able to understand the relationship specifically of an emotional or psychological conflict as it shows up, when it does, in the physical body, as, interestingly enough, a perfect solution to the psychological conflict at hand. Now, how could that be, you could ask, reasonably enough? Well, through an intense amount of analysis, study, intuition, and experimentation and observation, Dr. Sabbah has shown how these different conflicts, if not resolved on the psychological level, will then take root, if you will, or materialize in the body. So the body becomes, you could say, an outpicturing of that psychological conflict. This kind of knowledge and Dr. Sabbah's work with his colleagues is going to be spreading like a wildfire through the United States and other parts of the world. Why? Because it's helping so many people, so cleanly, so artfully, and skillfully. So with that said, Dr. Sabbah, bienvenue. Good to see you.
Same for me.
Good to have you on the show. Now let me say one other word. Dr. Sabbah speaks French. He even speaks a little Spanish, but he doesn't speak much English. So he has been kind enough to indulge me and do his best to speak English on the show. So please be patient and understanding as Dr. Sabbah speaks his finest English, but understand that he studied quickly in the last few minutes before we open the program to learn it. And I'll be helping you along the way.
Okay.
So with that said,
I'm going to try.
Okay.
To try in English.
Was there anything that I said, Dr. Sabbah, that you would want to add to or detract from in my introduction?
Yeah, no, it's correct.
It's correct.
It's correct.
J'étude. I am studying your ways. So you must be a very good teacher then. If you would, because right now...
It's a good program for you.
It's a pretty good, yeah, exactly. Maybe it will heal all of my illnesses. Maybe one of the most powerful things for people to hear about is the actual benefits that people have gotten that you know of. And like, for instance, right these last few days, you presented a seminar here on the eye, specifically on eyes. And we saw some remarkable changes happen with people over the course of these past few days. Could you just tell the audience a few of the stories of what work was done? And changes that happened?
Okay. That was during 3 days, the seminary specifically on the thematic of troubles of view and all the illness in the eyes. And it was very technical.
Very technical.
Very technical, sorry.
That's okay.
For students who knows very well yet total biology. And I gave a conflict very precise of a lot of illness in the eye. And in the room, the how you said, the room of
people,
seminary, the room?
Students in the seminar room.
Yeah, they were 250. 250 people. Some of them had
eye diseases.
Had diseases. I don't know the English word. Myopia, hypermetropia, retinite pigmentaire, maybe the
retinal pigmentation or something of that sort. Yeah.
And uveitis, cataracts. Yeah, lot of illness
eye illnesses.
Have the same word.
Yeah,
in French.
in English and French, yeah.
Everybody can understand.
Use their imagination.
Yeah, and when I gave the explanations, yeah, with examples, with témoignages, testimonials,
personal experiences.
Yeah. Some of them, in a particular instant, oh, that's my story, near my story. I understand when I was 11, when I was 14, just before the beginning of my illness, and the information made the comprehension,
yeah.
And from the unconscious level, that's
came to consciousness.
Came to the consciousness, and
they became aware.
And he thinks a little. These people thinks a little and resolve this conflict very precise.
Perhaps, Dr. Sabbah, you can give us a couple of examples from your many years of practice of results that you have seen with your patients.
Yeah.
What are a few stories?
Yeah. Okay, I remember this a case very interesting. He's simple and a good cure with this case.
Yes.
A young girl, about 12, had an hypothyroidism.
Hypothyroid condition.
Yeah. 3 years. The beginning was about 8, 9 years old. And with the total biology, with the comprehension of
the understanding of the system.
Understanding of the system. I question, answer of the mother, question, answer of this girl, and in maybe at the fourth consultation, the work was good, and the young girl remember that a few months between the beginning of the hypothyroidism, her mother was said every time to her, you have to care of your young sister. You have to care of your young sister.
You have to take care of your younger
you
sister.
have to see, but
very strongly.
very stronger for a man very important all the day. It's your responsibility. You have to care of, and the young
daughter,
sister, the young sister, was 2 years old. She was just
beginning to
the
walk.
beginning to walk, and she walked very slowly, very slowly.
She walked slowly.
And the sister,
older sister,
my young patient,
yes,
take it by the hand.
Take her by the hand, yeah,
And she was walking
slowly.
But that was too quick for the young. And
yes.
every time the mother, slowly,
Right.
slowly, too quick for her, too quick for her. Donc, the solution is aller plus lentement. I say in French, you can traduce very
To
go
more slowly.
more slowly.
Right.
And a few months after, hypothyroidism was beginning, because in the biology, it is a solution.
It was the way for the body to follow
yeah.
the instructions of the mother.
Yeah, I say.
Yeah.
Okay, it's that. But the mechanism is this
Yes.
one very precisely. Thyroid secretes hormones, and in
Right. Thyroidism.
hypothyroidism, hormones are low, and that in the organism make processes au
Also go
ralenti.
slow.
Ça ralentit tout. It's the solution in the biology.
Right.
She understands that. The mother understands that. And the little girl, now
Grown up
grown
a little bit more
it's not necessary.
to go
That
so
is
slow.
very, very and understand. That is understand very well in the two brains. The young girl resolved this conflict with a laugh, looking at this mother. It's for that. It's for that. And in the month after, hypothyroidism was finished.
So after 4 consultations,
yeah,
and talking about the treatment
yeah.
consists of your
Yeah.
posing questions
yeah,
to the mother and the daughter,
yeah,
and eventually you came to, or the daughter,
Yeah.
came to remembering
Yeah.
the instructions of the mother
Yeah.
to go slowly, and she put it all together
Yeah.
with your assistance.
Yeah.
And would you say that the recognition of that story as it connected to the hypothyroid condition
yeah,
was enough to then release that program?
yeah,
So it's the recognition
yeah.
that allows for the
Yeah.
release of the illness.
The program is reading in the conscience. Is don't stay in unconscious. That is a
So
mechanism.
through the recognition
A
is
little like
bringing it up to the conscious
okay.
level.
Yeah, a little like psychanalysis.
Right, psychoanalysis.
Psychanalysis system.
Sure. Making it conscious, that's the truc, right? The trick, right?
Yeah,
The
yeah,
thing that resolves.
yeah.
Beautiful.
I give the second example.
Please.
It's a case of low back pain. Is correct?
Yes, it
low,
is.
low back pain.
You will be my English teacher soon.
No. And it was in chronicization.
It was chronic.
It was chronic.
Chronic low back
It was
pain.
chronic from very long time. 30 years, well, even 40 years. The patient was
And he was only
a
20 years
little.
old.
The patient was a little older than the first example, and he was with treatments, anti-inflammatory. I don't know
Anti-inflammatory
yeah,
drugs.
and so on. He needs that. He takes that, but he tried to understand if a better amelioration is it possible, and he come to see me.
Basically, nothing else was working.
I don't understand
Nothing else. Les autres traitements
Oui.
ne marchent pas.
Il led.
They led him to you.
It's good. The other treatments and allopathic treatments was good for him. He has a good amelioration of on the pain, but
Not
always
complete.
here, always here, always here.
Not complete.
Yeah, not complete. And we work with the concept of total biology, and
Which is that you asked him
he
series of questions.
he do the connection between his conflict and his pathology, his pain. That was from a long time. He was younger. Il can compter. Il ne pouvait compter. Account only on himself. He was the pilier, comment on dit le pilier, the pillar of his life.
Okay. Oh,
And
okay.
colon,
Yes, okay.
spinal column. The correspondence is conflict with I have to be the pillar of all my life without its help.
Okay. So
You
also,
understand that?
Yeah.
And the pain in the low back go in 2 days. In 2 days, finished.
incroyable.
Incredible.
We have only, I tell you, you speak English better than I do. We only have time for one more example for the moment.
Yeah.
And what is it?
Okay, very shortly. The
Yes.
third example is this one. In the beginning of the war in France, a young woman, is pregnant of my future patient.
Right, with your future patient.
Yeah, a woman. And she's on train, and bombing,
Falling.
fall with and she ran. She leaves the train. She ran very quickly. She threw up
Herself on the
ground, and very afraid for the life of the child. And she did not hear that. It's terrible for her. This program passed in the baby.
She said, wait a minute, what did she say about the bombs? It was terrible for her to hear.
Yeah. She did not stand
The sound.
to hear that. This program passed in the baby. And 60 years later, this baby is my patient. And
With the hearing problem.
she comes for this. I am a deafness. I am deaf. And consultation, technique. She said important things I know, and I give to her this message. Near her, at his ear, I said, bombs, terrific sound. Yeah. Yeah, it's that. My mother said very often the story, and in 1 hour, I explained something more, and 1 hour after, she hears perfectly. This was not utile maintenant.
It's not unique.
Don't serve.
Right. The program ceased to have any value anymore, and she could let it go. And you basically, again, you bombed her unconscious. And that brought up the story, the program, and she could let it go.
Programming is here.
That's incredible. Dr. Sabbah, thank you so much for your work.
It's my pleasure. It's my pleasure.
Good, I'm so glad. This is not even the tip of the iceberg. I need to let you know I am very much on a learning curve myself, as you can see, and yet I want so much to bring more of this to you because this is utterly groundbreaking work. So I want to just thank you again and everyone who has helped to bring me here for this, and we will be continuing with some interviews so we can let more people know in the future. Thanks so much for joining us. This is Mitchell J. Rabin for A Better World, and I look forward to seeing you all next week.